Thank you, Speaker. And my question is to the Minister of Community Safety and Correctional Services. Speaker, last week the minister announced changes to disciplinary segregation in the province's jails and yet another review. But based on data received by the Human Rights Commission, a majority of inmates are isolated for reasons other than discipline. 40% were for mental health, and this Liberal Band-Aid does nothing to address that. The data has a name, Speaker. 23-year-old Adam Capay, locked up in isolation for nearly 4 years under artificial light, 24 hours a day. I'm sure that I saw Adam when I toured the Thunder Bay Jail, and the minister would have too. How does this government's changes to segregation help Adam Capay today?
Thank you, Speaker, and I want to thank the member opposite for asking this question, a very serious question, and one on this side of the House that we are acting on. And that's why last week, Speaker, I announced these changes in relation to segregation. And I have had an opportunity to sit down with Ontario's Human Rights Commissioner, Renew Montaigne. I've also spoken to the Ontario Ombudsman about this. And so, Speaker, we've introduced changes in our correctional facilities where segregation will be used only as a last resort, where there is no other viable option. And we've also reduced it from 30 days to 15 days for disciplinary segregation. We've created a weekly segregation committee review that will review the cases of every individual in segregation, and we've eliminated the loss of all privileges related to segregation, and we are improving the data collection, Speaker. There is important work to do as part of our transformation in our correctional system, and we're doing that work, Speaker.
Thank you. Supplement.
Thank you, Speaker. Segregation is the last resort. It's hard to make something a last resort when the government has cut all supports and it has become the only option. This government's knee-jerk announcement about segregation came a day after the minister knew his ministry's data was going to be released by the Human Rights Commissioner. This government has spent at least $44 million preparing for a lockout that never came. Surely, mental health supports to tackle the crisis in our jails is one area this money could have gone. Will the government end indefinite segregation, longer than 15 days, for all inmates, addressing the crisis in corrections and providing mental health supports for those who need it?
Thank you, Speaker. We are working to transform our correctional system, Speaker. We have, in fact, hired about 1,100 staff, correctional officers, since 2013. We've added 36 mental health nurses. We're adding body scanners to help make our correctional institutions safer. We've recently opened the Regional Intermittent Centre in London to help reduce overcrowding. Speaker, we take these issues very, very seriously, and that's why we've also announced last week an independent review, a third-party independent review of our entire correctional system in Ontario, with one of the keys, Speaker, being the reduction and goal of eliminating the use of segregation in Ontario. But as it stands today, Speaker, we are using segregation as a last resort, only when there is no other viable option. And those supports for the individual that the member opposite referred to are in place in all of our institutions.
Thank you. New question. The member from